Another Michigan hospital has implemented visitor restrictions today as RSV, COVID, and flu cases continue to rise. News 8's Megan Bunchman spoke with health experts on both sides of the states, and she joins us now with the latest on this subject. Meg?
Well, Rick, last month, Corewell Health, Helen DeVos Children's Hospital started to limit the number of visitors patients can have both during the day and overnight. And today, Corewell Health's eastside location in Royal Oak has followed suit.
We are seeing an increasing and high levels of respiratory infections and respiratory illnesses.
Doctors across the state say it's time to go back to the basics this month with washing your hands and staying home when you're sick, as cases of RSV, flu, and COVID in kids are on the rise.
We currently have 23 patients with RSV, and throughout the whole Corewell Health West, we only have a couple patients with influenza.
Last month, Helen DeVos Children's Hospital started limiting how many visitors patients could have in the building each day, 2 for the waking hours and 1 overnight, citing a high number of pediatric admissions and an increase in respiratory illnesses.
We are seeing a lot of respiratory viruses, especially affecting our youngest patients, infants and young children, especially young toddlers.
And new today, Corewell Health's East location is doing the same.
There will be longer waits than expected at our various emergency and urgent care locations.
While Dr. Andrea Hadley says that they aren't seeing the unprecedented number that they saw back in 2022, COVID cases have started to tick back up, with 8 patients hospitalized right now at Helen DeVos Children's. In October, the CDC issued a health alert following the shortage of the new RSV vaccines for those over 65 and pregnant women, but Hadley said that they were able to order a large amount of supply before the respiratory season started.
We have set aside a specific number of doses for the highest risk patients so that they will be available through the RSV season. And then the remainder of the doses will be equitably distributed to our primary care offices.
If you see your child struggling to breathe, doctors say you need to take your child to a local emergency room immediately. But if your child is healthy and you simply want to get ahead of possible infections this holiday season, contact your local pediatrician.
The most exciting prevention we have available now is a monoclonal antibody shot that can be given to infants, all healthy infants, as well as older babies that have underlying medical conditions such as prematurity and heart disease. And that is showing that it's very effective, and you need to try to get that as soon as possible, as we are seeing those rates of the RSV going up and a lot of spread through the community.
Now, while there may be longer wait times at your local ER, we're told that staffers are on hand to identify children struggling with these respiratory diseases to make sure that they get their help as quickly as possible in time for them to be healthy sooner than later. Emily.